The scene opens on battered streets of the Gaza Strip, trucks queued at crossings, displaced families huddled in shelters, aid workers unloading supplies. A voiceover sets the tone. More than 2 million Palestinians remain entirely dependent on humanitarian relief, yet the volume of assistance remains dramatically insufficient. We are absolutely ready to roll and deliver at scale, says Tom Fletcher, the humanitarian chief of the United Nations, UN. This moment of relative pause in the conflict may offer a window, but agencies warn the scale of the need demands a massive step change. Since the outbreak of war triggered by the October 7th, 2023 Hamas attack on Israel, Gaza has endured relentless bombardment, displacement and blockade. According to the UN, in recent months, aid agencies have managed to deliver only about 20% of what is required. Under the current ceasefire framework, the UN aims to deliver not just food, but medicine, shelter, clean water and sanitation at much greater scale. One official made the scale explicit. The level of destruction and devastation is just absolutely immense. Gaza's infrastructure is shattered. Over 80% of buildings in Gaza City damaged, roughly 40% destroyed. Hence, the moment is urgent. Failure to scale assistance risks deeper humanitarian catastrophe. Multiple humanitarian agencies are sounding the alarm. Fletcher told UN reporters that all entry points must be opened, that aid needs to enter at a much, much greater scale than before. The issue is not simply more trucks. It is more supplies, more destinations, more people reached. The UN's target for the first 60 days of the ceasefire, between 500 and 600 aid trucks a day. In parallel, the organisation argues that delivery of emergency medical care, restoring water and sanitation, deploying community kitchens and tents for winter must all be scaled up rapidly. A piece published by Refugees International described obstruction of aid access as a biggest threat to the ceasefire deal's success, calling on neutral oversight and unfettered access. In short, the rhetoric is firm. This is not merely a humanitarian operation, it is a race against time. Despite the ambition, the reality on the ground remains deeply problematic. On 14th October 2025, Reuters reported that Israel would permit only half the previously agreed trucks into Gaza, limiting entry to around 300 trucks a day, down from a target of 600. Fuel and gas are also severely restricted. The Israeli military arm in charge of aid flows informed the UN that fuel entry would be restricted to specific needs related to humanitarian infrastructure. Aid agencies emphasized the need for unsafe and unimpeded access. Without the opening of all crossing points and the easing of checkpoints, the delivery architecture collapses. The logistics of moving supplies inside Gaza are also daunting. Roads destroyed, sanitation networks collapsed, heavy equipment required for rebuilding. One analyst remarked that there is no modern comparison to the required scale of reconstruction. Thus, the gap is not only in volume of aid, but in the mechanisms to deliver it. Amid these logistics are millions of lives, families who have lost homes, children who have missed years of schooling, hospitals functioning in partial ruins. One official said the war damage combined with the blockade has pushed Gaza into a hunger crisis, including famine in parts of the territory. When fewer trucks enter, fewer meals reach vulnerable families. Food markets collapse, prices soar, basic staples become unavailable. Even in places where aid has trickled in, the strain is visible. Hospitals devoid of power, clean water unavailable, sanitation compromised. The failure to keep up with the scale of need raises the risk of malnutrition, outbreaks of disease, and further deaths. As one report put it, the longer the delay, the higher the toll. What exactly does scale up mean in numbers? The UN target is 500 to 600 trucks daily, reaching 2.1 million people with food and up to 500,000 needing nutritional supplements. Yet agencies say the actual figures are far behind. One Reuters dispatch noted that while 817 trucks entered on one day, the target was not sustained and the total remains insufficient. At the same time, reconstruction costs mount. Rebuilding Gaza may take decades and cost up to $70 billion, according to experts. Thus, what is required is not simply more aid today, but a sustained multi-year commitment. Funding must match ambition. Without significant donor contributions, even vehicles and supplies cannot move. The UN itself warned that 170,000 tons of aid ready to enter Gaza is just the tip of the iceberg. In short, the gap between resources mobilised and resources needed remains wide, risking that the scale remains insufficient to match the crisis. Multiple hazards threaten the success of the scale-up. First, political conditions. Access is tied to security and hostage negotiations. The 14th of October 2025 Israeli decision to cut aid due to slow release of hostage bodies illustrates the fragility of the promise of help. Second, distribution and delivery risks. Trucks may arrive, but moving inside Gaza, reaching displaced populations, securing safe delivery remains extremely difficult. Aid agencies warn that unless aid reaches all regions, including the north, central and south, the overall effort falters. Third, long-term sustainability. Emergency deliveries must transition into restoration of infrastructure, health systems, water, sanitation, education. The risk is that if relief remains stopgap, the crisis will re-emerge. Fourth, funding fatigue. As the emergency becomes protracted, donor attention may wane, yet the needs grow. If funding lags, agencies will be forced to prioritise and leave large populations underserved. The combination of these risks means the window of opportunity may close, with huge human consequences. As the ceasefire holds fragile, the pivot from fighting to relief begins. The question is whether this moment will be seized. Agencies emphasise that scaling up humanitarian assistance is not a luxury. It is a moral imperative and a strategic one. For the people of Gaza, the difference between aid delivered at massive scale now and delayed, muddled efforts may be life or death. The next few weeks matter. Will trucks roll in at hundreds per day? Will crossings open fully? Will funding match the intention? Will distributions reach the hardest hit areas before winter and before hunger turns into famine? If the world responds with the urgency required, relief may arrive and lives may be saved. If not, the crisis will deepen. For the Palestinians in Gaza and for the agencies committed to helping them, the clock is ticking. For 2 million Palestinians, this is more than assistance. It is survival. The scale-up of aid is not optional, it is essential.